Hi, I'm Dr. Rudy Cashman. Welcome to the Wellness Show. You can look at some of my other shows on cashmanhealth.com as they cover every aspect from diet to health habits. And today is very interesting because I attend some conferences and look at some businesses, and I see that smoking really is still a tremendous problem among the people. This is a judgment-free zone. I'm not blaming anybody. It's highly addictive, and it's not. Some people perceive that it's difficult to stop, and we generally hear 22% of the people are smoking and it's going down. Well, I got news for you, and I don't know if even at our county level or state level that people know. I visited 3 different factories recently, and that's why I'm here partially, and I've dealt with some truck drivers too, that it's of great concern to me that a factory I was speaking at, 300 employees for a Christmas thing, and the employees were telling me about 70% of the employees are smoking. 70. Besides ruining their health, it was costing them a lot of money. The gentleman I was sitting next to had quit, and it saved him $300 a month. That's significant. That's significant, obviously, to almost anybody. And I thought that we need to figure out, I think, maybe a different way of teaching it. I even spoke to the Macmillan Foundation at a meeting there, just one individual. And they were saying, well, if we save one person, then what we're doing is good. That's fine. I agree with that. You save that one starfish. But when 70% of the factory workers are smoking, I think we need to wake up and say we may need to redesign this, give different incentives, maybe some more detailed teaching. I don't know the total answer, but let's go through it here a little bit. But that's why I'm here. And the majority of truck drivers, when they're driving, they're smoking. But that's not. And then again, I met one of these gentlemen where I had given the talk, buying a cup of coffee at Starbucks. And he had a sign on who he worked for, and he said he enjoyed the lecture. He also mentioned that about 75% of those 80% drank a lot too. So I think for us to just keep on walking and say as physicians and providers, well, that's the way it is. I don't accept that because to take a certain class of people and you just write them off, die 20 years younger, a lot of them are in pain and ruining their families, I do not accept that. I do not accept that. And because I've studied this a lot, that in reality, I think a lot of people are in great fear to stop smoking, when in reality, they withdrawal symptoms, your nicotine level goes down, are not that severe. Most of those symptoms are over in a week. So we can keep you entertained for a week, or tell you what to do. You're on your way. It takes a little longer to get rid of a habit, but a lot of the withdrawal difficulties, sleep deprivation or irritability, anxiety are gone in a short period of time. So I think for one thing, I think a lot of people do not know, lack information, do not know. You think you know, but you may not know what smoking does to you. First of all, it affects your brain. It's highly addictive. It takes only 7 seconds once you smoke for the nicotine, and that is the addictive part, the nicotine. See, smoking comes with about 5 to 10,000 nasty other chemicals which cause the harm, which are ones that cause the harm. The nicotine itself is not that harmful, except it addicts you, makes you come back to want to do it. But it's the chemicals that cause the damage and affect your brain. 7 seconds. Yeah, 7 seconds. Maybe for a lot of people it takes a week to become addicted. So that don't take that first one. So it has great effects on the brain. It causes, it's a habit, you become habituated to it. Then you develop tolerance, you need more, and then you turn into a true addict, and then you have a cigarette, and you feel a little better. It affects the dopamine, the feel-good hormone. about the other ways to get the dopamine hormone up, listening to music or dancing or exercising. Laughter can increase your dopamine. It's a quick fix, no doubt about that. But within 10 minutes, bang, withdrawal starts, and it's already at 30 minutes. It's pretty darn hefty. And what a lot of people probably don't know, that it affects a lot of your cranial nerves, your hearing, the vasculature to the cochlea, ischemia, and smokers will lose their hearing over a period of years. It affects your 300,000 miles of capillaries, blood vessels, by putting them in spasm, putting them in inflammation. When I look at a smoker, I see a fire. I see their body on fire. They have a constant fire going. They have a constant fire going on in the vasculature of their body. So all those 300,000 miles of blood vessels are affected by just a cigarette. Yeah, I mean it's bad. I mean, matter of fact, it has such effect on the blood vessels and in your brain that I remember seeing in practice some people where the vasculature gets so impaired. I mean, they have heart attacks and strokes. I mean, we all, I think, know about that. In their legs, that they start amputating their toes, then their knees, then their hips, all the time while they're sitting there in their wheelchair and they get one leg amputated, they're still smoking away. And they're particularly sensitive to cigarettes. There is a subclass there that it affects all the blood vessels, but that group is extremely affected by it. They'll amputate them right up to the hips, right and left, and they're still smoking. So does that mean it is that addictive? Well, I tell you, cocaine, heroin, morphine is more addictive than cigarettes. Sugar is more addictive. That's why when you look at the nation, most people are overweight, a lot of obese. We got all diabetes and all the diseases they're from. Sugar is more addictive than cocaine and even cigarettes. But I think our perception of other cigarettes is wrong. So it affects the vasculature of our whole body. That's why smokers look 10, 20 years older than other people. It affects the elastic tissue of the skin. It affects your eyes. It can cause blindness, visual loss, increased rates of cataracts, increased rates of retinal disease. Yeah, visual impairment is common from smoking. Yeah, especially cataracts and retinal disease, where you just turn blind, is common in smokers, and to make them look a lot older. You take this pretty woman and I've seen it, and a handsome guy, and they look 20, 30 years older than they really are. And just it's from the vasospasm and the atherosclerosis and the inflammation in the body. So that is extremely common. They have macular degeneration, cataracts, cavities in their teeth, a much higher rate of cavities because of vasospasm in the gums. And to have tooth loss is common in smokers ahead of other people, okay? So wrinkling of the skin, it affects elasticity in the skin, it affects in the heart, it affects the mitochondria, the energy molecules and the energy factories in your heart. It shuts them down. Your blood becomes sticky, so you're much more likely, if you have atherosclerosis, which would be natural for a smoker, that when the blood clots, bang, heart attack, sudden unannounced death. Many times unannounced. It isn't that I have angina or a chest pain or a warning. They just grab their chest and they die. You're dead, but your family is suffering the rest of their life. Okay? Forever. Families will suffer forever. You may die. So increased rates of heart attacks, increased rates of strokes, and of course they're totally destructive to the lungs. The tar tissue interferes with the cilia, the little hairs that clean out your lungs. You lose them. They just die out. And the lungs become black. That's why they call it black lung. Increased rates of lung cancer. There are increased rates of cancer all over the body because the chemical changes that nicotine, or the chemicals with the nicotine cause, it's throughout the body. So the increased rates of cancer in every organ, much more so in the lung though, and then they'll spread to the brain. And being a brain surgeon I was for 45 years, I saw a lot of patients with a tumor gone to their brain, sometimes spread all over their body, most of them dead in 6 months, the majority. But it's all preventable. Okay? And so it increases the cholesterol level, stiffens the arteries, causes arteriosclerosis, inflammation. It's like a body on fire, when I see a smoker. And we spoke about the amputations and the scarred lungs with emphysema. Is they choke to death. They can't expand their lungs anymore. They can't walk a step. They get the oxygen level drops. So you see them with the oxygen machines standing in the markets. You see them as they come out of the house, brought there by somebody in disability, a truck. They can't take 2 steps and they're short of breath. That's emphysema, because the little alveoli that expand to bring oxygen in and get rid of the CO2. It's oxygen in, CO2 out. This disease is characterized, these alveoli are full of CO2, can't get it out because they can't contract. So, and then you can't bring oxygen in and they choke to death. Can you imagine that feeling? Just choking, you can't take a breath. And again, can be avoided. It causes stomach problems, a big belly. Smokers have big belly because it destroys the muscles. It destroys the muscles all over the body. Again, because of the vasculature, and a lot of them have big bellies. It decreases the estrogens and the hormones in our body, so a lot of smokers have erectile dysfunction. Yeah, a lot of them develop that, and it affects your immune system. So, because it changes the DNA in your cells, and it weakens your immune system, so you get a lot more colds. I know somebody that smokes and they seem to have a cold all the time because their immunity went down, and it causes osteoporosis, muscle atrophy, and so I could talk all day on the side effects, but we don't want to do that. So let's think of ways of quitting. Many different ways, obviously. There are substitutes. Some use gums, some use smoke-free nicotine gums, for example, but the nicotine effects are the same, okay, and it's addictive. I know a gentleman that had lung cancer spread to the brain, and he never smoked. That was unusual. Where I found out he was chewing the nicotine gum, which his wife, he didn't tell me, but his wife told me. I had another patient, remember, a beautiful blonde, had come to see me with back pain and leg pain, and you might have thought she had ruptured disc. Pain was so severe, I thought there's more to this than that. So I studied her, and she had, her sacrum was totally eaten up with cancer. That's a kiss of death diagnosis. 45 years old, beautiful lady. Her husband comes in, who looks sicker than the dog, smell from smoke, yellow teeth. I mean, he looked extremely ill. He reeked from the stuff. I took him downstairs to show him the x-ray to be a little more private. To tell him his wife's going to be dead in a few months. He couldn't walk down the flight of stairs, and normally I'm very kind to people, but I must say that was secondary smoke. She didn't smoke. It was totally secondary smoke from him. He didn't have the courtesy to step outside and kill this beautiful woman. I'm certain the way he looked, I told him, normally I wouldn't do that, but he really ticked me off. Because he had this beautiful, intelligent woman, and he killed her. The secondary smoke killed her. You have to look at that. How are you going to affect the other family members with your diseases? People need to take care of you in wheelchairs. If you get amputated, you become impotent. How are you going to affect the family? It's not just you. It's the family, too. And so that's the reason I'm trying to see what we can do here. And what are the benefits of quitting? Obviously, in 20 minutes, your blood pressure goes down. In 8 hours, your CO2 level goes down and O2 goes up. In 24 hours, your cardiac risk goes down. 18 hours, the food tastes better. 72 hours, your breath smells better. 3 months, shortness of breath goes down, and you stop 5 years and the lung cancer rate goes down 50%. You stop 10, 15 years, your precancerous cells return to normal. So in 10, 15 years, you could beat it. But don't say, well, I'll quit in 2 years and then in 15 years I'll be fine. You may be dead by then. Don't use that. But what I'm saying is there is hope. There's hope, there's hope, there's hope. There's two. And now they're talking about e-cigarettes. About 25% of the kids have tried e-cigarettes. And you just get the nicotine, you don't get the chemicals. But the darn trouble is you're addicted to nicotine, which is on the path to addiction. It hits the dopamine circuitry, alcohol, cigarettes, sugar from food, marijuana. They're all on the same circuitry. You're just on the addictive path to jump to bigger things. So if you're a teenager or if you're using e-cigarettes, throw them out. Because it gets the habit going and you'll switch to other things. There's a gentleman who teaches smoking cessation in England, and that's the main method. He does it all over Europe, and he just quit. Announce it 1 week from now. I'm going to quit, and have a plan. Write it down. That remember I said, is throughout his books, withdrawal symptoms may be over in a week. The habit of doing it maybe in about 3 weeks, and you have a certain amount of psychological dependence, and develop a plan. What you're going to do: take a walk, exercise more, play some music, take up dancing, and some people watch funny movies, for example. Keep their brain busy. I would recommend develop every time you have some withdrawal. And actually, I'm working on it. Maybe a 2 or 3 minute exercise program. You do it while you're standing there. You know, shuffle dancing. It's one of these German dances where you touch the heels and move. Some movement thing. I was planning to teach this to truck drivers, where you secrete endorphins because of the activity, and you feel better right away. That might be a good way to do it. But this is not heroin, cocaine. Their withdrawal symptoms are minimal compared to any of those things. Very little pain involved here. Just keep yourself busy. It's the habit you got to get over. Put something else in there, a pencil, whatever, if you need to. Or just decide, I'm going to work out an hour every day or something different, some other habit to try to break the habit and the psychological dependency. A lot of people are afraid of they'll be eating more, so they'll gain some weight. That certainly can happen, but just pick nutrient-dense food. If you pick nutrient-dense food, foods of color, eat all you want. You'll not gain weight. That's an easy answer. Just eat nutrient-dense food, and you'll not gain weight. And learn what your triggers are for smoking. You know, if you hang out with certain friends, go to a certain place, a bar, for example, where everybody's smoking. Now in this town, I think you can smoke in any bar, I don't think. Where you smell the smoke is more likely to happen. So write down what are things that accuse to you to smoke, and don't accept, well, I just have one cigarette. That's not going to happen. You're feeding that little guy that's living with the little monster within you if you just one cigarette. This gentleman in Europe would say, just quit. Now other ones would use some smoking substitutes, some medications, some patches, for example. Ibuprofen is a medicine that is used for even drug addiction, has some value. So there are pills and patches you can try, and the patches you step down. But withdrawal tends to, many times people have about 3 to 5 failures, but that's not a failure, okay? No plan is a failure. If you get a plan, it's just a bad day. It's not a failure. And at least you had a plan to get rid of, because who wants a life of what I just read to you? And that's not even the worst of it. But I will say the amputation story is the worst. Let's go chop legs right up the body. I mean, you want to live like that? Come on. And but it's difficult for some people to make up their mind, no doubt about it. It's easy for an unsmoker to say it, another one for a person who has it, because people who smoke, they're living down here, you know, that down here, there's like a day where they could feel good, where they feel good. I understand addiction. I give other talks about other types of addiction. I fully understand, but you got to get the feel-good hormones, the endorphins, not from nicotine. It has to be from something else, from laughter to yoga to exercise to walking to whatever. And you can't get it from this from cigarettes. And I mentioned medications, and you can slowly bring these patches down, and that helps people. Yeah, some people did it that way. Some people use smokeless tobacco to do it, but a lot of kids, because their brain isn't developed, they use smokeless tobacco. They actually increase their chance of becoming addicted, even to narcotic addictions. It's on the path to addiction. So even smokeless tobacco has formaldehyde, lead, cadmium, hydrocarbons. People use smokeless tobacco have cancer of the mouth and gums and dental disease and bone loss and bad breath. And that's the other thing to consider, is that when you're smoking, it totally destroys your home. We all know when we enter a home of a smoker. I mean, everything smells. I remember those most beautiful German couple living behind my cousin in Boston, and I would visit them because they were from the old country. But when I visited them, I thought they'd be dead in 5 years. And these people in their 60s were both dead in 5 years. Very intelligent, humorous gentlemen. I still feel sad about it. Withdrawal symptoms generally are mild. They're not that bad. Maybe a little slight depression, a little anger, a little anxiety, a little irritability, decreased sleep, and a little headache, maybe a little more hungry than usual. You can expect that, but it's not guaranteed to happen. Some people have no symptoms at all. They're just over it in a very short period of time. So don't be so pessimistic that this would happen. And cigars too, well, they're not addictive. I smoke cigars. Baloney. Cigars are addictive, and they're not regulated by laws as much as cigarettes, so watch out for that. But nicotine replacement therapy, NRT, your doctor can prescribe those things. You can quit more comfortably. Some people need group therapy, and if you and a friend want to go on this venture together, but maybe the friend should not be a smoker, okay? Because if he lights up, you're going to light up. So get a non-smoker to help you to increase your endorphins, your feel-good hormones, best through exercise or singing or going to a funny movie or watching a funny DVD. And try not to be alone, because when you're alone, these things increase. So support groups are helpful. And you can go online to smoking.gov, and I can name you 100 websites. Just one leads to another. And read some of this information. In the American Lung Association, the American Cancer Society, they try do their best to help you. But I will say, and I'm not sure they know it, I'm going to meet with them, but 70% of the factory workers, there are 3 different factories that I went to, are smoking, and they're drinking at a pretty good rate. We really got a problem here. It's not just itty-bitty problem, well, we tried, we did this. No, we got to change the way we teach it. I do not blame the person that's addicted to it. They're an addict. Let's be truthful. They're an addict. Down here, they just like to have a few minutes where they feel good. And can you imagine that they have withdrawal every 30 minutes? Would you like to feel bad every 15, 20, 30 minutes? My God, I don't know that I would survive it, And so I'm glad I didn't start. And so we have to figure out maybe better ways and to prevent it in the first place, to educate people more that they truly know the side effects before they even consider starting, say, at the school level or whatever, I think is very important. Most people actually do not gain weight when they stop smoking, okay? And but the nicotine suppresses your appetite center. That's the reason people like to eat more when they stop a cigarette. But if you eat nutrient-dense diet and you exercise a little bit, which would help your smoking cessation and your weight, eat all you want of nutrient-dense food, exercise a little bit, and that's not going to be a problem. So don't just worry about that. And so, in summary, I don't want you to throw in the towel. I am not going to allow, till the day I die, for 70% of the people who don't get it on smoking. It appears to be factory workers, maybe certain ethnic groups, I don't know, economic groups, stress. Maybe they have a lot more stress, for example. Then let's teach them other ways to deal with stress. I'm not going to write them off and have them die 20 years younger than I did, although if you read the paper, you see that the death rates in 40 and 50-year-old white people especially is increasing at a tremendous rate. And I think it's bad health habits of sugar, diabetes, smoking, maybe drinking, and just to write, and of all racial groups, all ethnic groups, just to write people off. I'm just not going to do it, because this is stoppable, preventable, reversible. This is not a hopeless thing, especially eating right and not smoking, not drinking too much. It's doable. We got to find out better ways for them to increase their dopamine to feel good. So join me in my other lectures. Look at CashmanHealth.com. I got every Tom, Dick, and Harry thing covered there almost, because I enjoy getting people well. My mother told me to be a doctor. I think that's what I'm doing. And go to other group meetings, look at other websites, become really informed, much more information than I even gave you. You have any good ideas for me, how I can teach it even better? Stop me at Starbucks. We'll have a cup of coffee and talk about it. Or meet me at one of my talks that I give. I really want to thank you for allowing me to speak to you. It's a labor of love. We love you. That's why I'm here. I could be playing tennis or pickleball like I do, but I'd rather spend Friday afternoon getting this little talk for you. And if you quit because of it, please send me an email or look me up or whatever. I'd sure like to know about it. That encourages me. I've done a lot of that for type 2 diabetes. I'd like to do some of that for smoking, and maybe give some ideas how to better educate people about it. I think would be helpful too. And we love you. I hope you have a great day. It's a beautiful day in Fort Wayne today. And I'm going to maybe take my second walk to increase my endorphins. Okay. I love you. Bye-bye.